Hello, I'm Robert Simmons. This video is part of my series that I call People Who Make a Difference. And in today's video, we're talking to my doctor, Dr. Bill Warnock, of the Champlain Center for Natural Medicine in South Burlington, Vermont. And Bill's been my doctor for 25 years or more. And I can say that he's made a very big difference in my life, both right from the beginning and still to this day. So one of the things I wanted to do was interview Bill and ask him to talk about his approach to medical care. Bill is a naturopathic doctor, and one of the things I always like to begin with when I talk about this with my friends is I say what the difference is. So maybe Bill, you would say.
Our focus is really prevention, helping a person stay as healthy as they can during their lives so that when they're 60, 70, they're still healthy. We identify, for example, high cholesterol at an early age and take steps to prevent or to reduce that. We look at symptoms of prediabetes and reduce the risk of that. The things we use are vitamins, we use herbs sometimes, but we also focus on lifestyle, diet and exercise to keep a person healthy. Naturopathic doctors in Vermont have a full scope of practice, meaning we can prescribe any medication, we can order any test, make any referrals, just like an MD can.
Right.
And for most of my patients, I am their primary care. So we have insurance coverage from all of the insurance companies in Vermont to cover our services as either primary care or some people see me as specialists, but most of my patients really are primary care.
Right. I know when I first started coming to you, I was in my early 40s, and I'm now 68. I was probably close to 20 pounds heavier than I am now, and I had a bunch of different things that were not quite right about my health, and we won't go into that, but when you talk about the way you treat people over time, you know, my personal experience is that. And you know, as of now, I feel like I'm as healthy or healthier than I've ever been in that whole time.
Well, I agree, you are. And like I said, that is our focus, but it's also the case that people might have an acute illness somewhere along the line, a cut, tick bites are common in Vermont, so we have to treat tick-borne illnesses. There's a whole bunch of things that people come in on a daily basis for an acute treatment, and in that case, because we're not focused on prevention but rather treating, we can still use natural products, but often in those cases, the prescription products on a short-term basis work really well.
Right, and that's a great situation in Vermont where a naturopath like yourself can prescribe drugs if you feel like they're appropriate, but you still have your focus on natural care as the first go-to.
Right, and we're always looking towards drugs as a temporary solution because they do have a lot of strength and efficacy in treating various conditions, so we're certainly not anti-drug in any way.
But let's talk for a minute about what's different, which I think, at least in part, is this, in the spectrum of treatment you offer, you have vitamins and supplements as a big part of it. And I know that's different from what many other kinds of doctors do. And I know you've said that there are some supplements that probably about everybody should take. So I thought we'd get into that.
Yes, and I think that's going to be the focus of future videos that we're making. But I can say right now that there are 5 main generic supplements that everybody should take. And it's really based on the philosophy that there's a difference between surviving and thriving. most of the world, people do not take vitamins.
Right.
That's a reality. Most of the people in the United States don't take vitamins, and they are living their lives. But there's more than just living out your life, getting old, having different ailments. There's thriving in a way where you're optimizing what you're born with and healthy and happy.
Right.
And that really makes a difference, I think, in a person's life.
Okay. Well, I've got to tell you that I've enjoyed talking with you, Bill, and I've got to tell the people watching this, I'm one of Bill's biggest patient advocates. I tell all my friends about him and his practice, and I've had a lot of them come to Bill's practice, and it's been a good experience for all of them. So I hope you've enjoyed this. I hope you want to stick around with us or come back and see some more of what Bill has to say on this series of People Who Make a Difference.